Practitioners and Doctors Union has called for a 14-day strike for doctors and healthcare workers at the Kenyatta National Hospital from next week. Now, this comes as they cite discrimination of their salary payments. And as Werimu Kimani reports, the union has criticized the government for paying health workers just half of their money.
There is a looming crisis as healthcare services may be disrupted starting on Monday next week at Kenyatta National Hospital following threats of a 14-day strike by healthcare workers and doctors of the hospital.
For the union makes us strong. Yeah.
This follows delay in salaries. The healthcare workers have raised concern over not receiving half of their well-deserved payments.
We are seeing Kenyatta National Hospital discriminating against doctors and against healthcare workers, where some they're paying half the salaries that are being paid to the rest. And therefore, Kenyatta National Hospital will be issuing a strike of 2 weeks beginning next week.
The union has also demanded a salary increment for all doctors in the country, stating that following the passing of the finance law, 52% of their salary is currently taxed, and therefore they are calling for emergency discussions with the Ministry of Health to resolve the crisis, since it has been 7 years since their last salary increment.
That Finance Act, our payroll, or rather our salaries, 52% of it will go to tax. And as such, the neck of the union has resolved to demand for a salary increase for doctors across the country. We are demanding for collective bargaining agreements to be rapidly negotiated so that we can have salaries that are commensurate to the changes in the market price of commodities.
Speaking at a press conference, KMPDU Secretary General Davdi Atela noted that the association has rejected President William Ruto's proposed additional deduction tax of 2.7% for the medical insurance fund for employees and an increase of 500 shillings for the unemployed.
So we are saying there's need for NHIF to actually be accountable. Despite all these challenges, we are seeing that the government is proposing to increase the deductions for NHIF to 2.75% of the gross. So without accountability, without mechanisms that will ensure benefits for the Kenyans, we as doctors are rejecting these proposals in total.
This union has also indicated that the healthcare services in different counties has been deteriorating despite the promises made that the Ministry of Health in the country will be given priority in last year's election manifestos, and up to now, nothing has been done.
We have noted with a clear concern there's this declining state of healthcare in the counties. It's now over 8 months since we did the August 2022 elections. We had hopes in the county governors, we had hopes with the government that there will be change based on the promises that they gave in the manifesto.
The situation has only become worse.
But on the opposite, we have seen a much frustration. To start with, we are seeing healthcare workers who are providing services diligently, like in Nakuru County, being dismissed unceremoniously.
Werimu Kimani, Look Up TV.
Just power.